Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Matthew Sherrer. He's an anesthesiologist, and we introduce Chris Turner. He's an emergency physician. They both wrote a KevinMD article, The Shocking Impact of Incivility in Healthcare. Are your team's behaviors putting patients at risk? Matthew and Chris, welcome to the show.
It's lovely to be here.
Kevin. Thank you.
All right. So, Matthew, tell us what this article is about for those who didn't get a chance to read it.
Yeah, so this article is about incivility in healthcare. I got introduced to Chris, a year plus, maybe a couple years ago. He runs a platform called Civility Saves Lives. I have become just a huge fan of his work and what he does. We've kind of struck up a friendship over the years. And his website is just resource on resource on resource. And full transparency, those are the resources that I used to kind of frame out this article that he and I wrote together. So I've become a big fan of his work. I would consider him to be the expert in this field and me to be more of a fanboy at this point in time of Chris Turner and his work.
Perfect. So, Matthew, what's the article about?
So it's about incivility in healthcare, the data behind that. There's tons of data. Christine Porath kind of brought a lot of the initial really shock around some of the data surrounding incivility in the workplace to light in 2013 with an HBR article. Followed it up with a book called Mastering Civility in 2016, which is a fantastic read. And then we kind of took it and looked at it from the healthcare perspective, right? This is not just a business thing. This is a healthcare thing. We've all experienced incivility in healthcare. And I think we really might not fully appreciate the impact of it. There's impact that we can talk about and we'll break down over the course of the next few minutes, I'm sure, but it is a huge impact to the people that we work with. And the take-home message just being that the way that we treat each other at work matters tremendously.
All right, Chris. So, as Matthew said, you have an organization dedicated to looking at incivility in healthcare. Tell me how this organization came to be and what were some of the reasons why you started something like this?
Okay, so we're not really organized. We're more of a grassroots healthcare social movement with lots of different people who move in and out of it. And it came about because about 7 or 8 years ago, I became aware of the demonstrable impact that poor behaviors have on our ability to perform at work. And I decided to give a wee talk about it, just one little talk. But I gave that talk and 3 people in the audience asked me to give it in their departments and so on and so forth. And literally it was like a viral thing. And the reason that we started talking about it was because a whole bunch of us recognized that our performance plummeted when we felt we'd been treated in a way that didn't respect us. And there wasn't really evidence out there. But then, as Matt said, Christine Porath, Ami Reyes, a bunch of other people started to look at this. And it became clear this isn't a me problem. This is an us issue. And we can do something about it. So that's how it came about. And people got on board. And there's people all around the world who are really interested in this because it's like a hidden facet of both safety and excellence.
And Chris, when we talk about incivility, what exactly are we talking about? Maybe you could give us some examples from, say, an emergency department setting.
Okay, well, emergency departments are fairly extreme settings of the sort of incivility you might see, but generally the research is done on what's regarded as low to moderate level incivility. It's the behaviors that you're not quite sure if they're meant to be offensive, but they make you feel uncomfortable anyway. So somebody who rolls their eyes when you start speaking in a meeting, somebody who tuts when you speak, somebody who speaks over the top of you, it feels a little bit like you're thinking, do they mean to be offensive? The thing about it is that it still has an impact on the person on the receiving end of this. And the impact is significant. I mean, Matt alluded to it, but in the moment, if I was to treat you in a way that made you feel disrespected, it's a 61% reduction in your cognitive ability. Your bandwidth shrinks right down. You can't think so well. And in our healthcare environment, that's a disaster because we're all relying on everybody else performing at their best. It's not good enough just to have one person who's an absolute rock star. You need a whole team who are working well together. And that's how we started getting into this stuff and why it feels so important.
So, Chris, to clarify, an episode of incivility results in a demonstrable impact in a clinician's performance. Is that what you're saying?
Absolutely. And even when we don't think it does. and Dan Katz did work on this. He's an anesthesiologist in New York State. Even when we don't think it has an impact on us, it still does. We think we compensate, and we just simply don't.
Matthew, give us examples of incivility that you may have observed in your own setting or that you've heard about other physicians talk about.
Yeah, well, I've certainly experienced it. And to be perfectly honest, if I'm fully transparent, I've probably been uncivil in my career at some point. You know, the operating room is a high stakes, high volume environment. We're doing really big, sometimes dangerous stuff. There's a huge volume pressure. And so just as Chris said, not overt violence or overt acts like that, but just simply the eye roll, the comment that's a snide comment. We see those frequently. And as pressure builds on the healthcare system, more and more and more it becomes, you know, we've talked about the fact that it's a volume game still. We just continue to see this over and over and over again. And one of the things that Chris has kind of pointed out in his work that I'll add here is that it not only makes us less capable, but simply witnessing incivility makes people less likely to help others. The OR is a team environment. And when you simply witness incivility, if you're less likely to hinder others, not only, as Chris says, are you less capable, but you've made your team less capable. And that's kind of what we pointed out in the article, is that it inhibits both those individual factors that contribute to team success and the team factors. And as Chris has said in his TED Talk and other places, that is a toxic combination that we wanted to bring to light.
So, Chris, what are some of the approaches to address incivility in the healthcare workspace? Because I could imagine if someone observes an episode of incivility, they may be a little bit hesitant to perhaps speak up, or there's no recourse or no organized recourse for them to speak up. So what are the options, as Matthew said, if one witnesses incivility or is the recipient of incivility?
Okay, Kevin, if you don't mind, I'm going to go back a wee step there and say the first thing that's been shown to have an impact is simply talking about it, like we are doing just now. People are good. People want to have the best outcomes for them, for their patients. How we behave is like a drug. And it's like a new drug because we didn't know it made a big difference. Once we start talking about this, once we start recognizing it, there's a whole bunch of people who just choose to change their behavior because they were never behaving negatively because they wanted to diminish others. They did it because we've had it role modeled to us. So the starting point is just talking about it is a proven intervention for getting people to change their behavior. And that's work by a woman called Anna Baverstock, who's a pediatrician in Somerset. Beyond that, how you go about challenging it is that's much harder. There are really good ways of challenging around uncivil behavior, and most of them are born from the work of Jerry Hickson at Vanderbilt and the cup of coffee conversation and getting a second messenger to speak to somebody. So not challenging back yourself, because actually we're so diminished that we're not good at doing that. Getting somebody else to have the chat. So Kevin and Chris have a bad interaction and Kevin feels lousy. I know you want to be able to come and tell me that I made you feel lousy, but mostly that's really difficult for people and they don't do it well. Turns out that getting Matt to come and talk to me about my behavior is much more effective because Matt, in a conversation with me, can take the judgment out of it. He can assume that I meant in the positive and he can be compassionate to me. And that's almost impossible for you to do. And when he does that, there's a chance I can hear it and I will then go and change my behavior.
Matt, give us an example of some changes that you've seen departments make to address this, maybe utilizing some of Chris's techniques. What are some ways to, from a perhaps systems level, that can approach this?
Yeah. So kind of one of the things Chris alluded to is I think that a lot of people just don't know about this, right? We are evidence-based clinicians, right? And we certainly understand the evidence behind what I do in the operating room, what Chris does in the emergency room. But we also have to acknowledge that we work in a team environment. And so therefore, to be evidence-based practitioners, clinicians, we also have to understand the evidence behind civility, right? Behind teamwork. And so I think going out and educating on this is really the intervention that I've seen. And again, haven't seen it a lot. I know at my institution, I have a talk on incivility. I have a talk on teaming. I have a talk on humility and all these topics. And so really I think we're kind of at the education state right now. I'd love to say we're further down the line than that. I can't really say that in the institutions that I've been, but as Chris said, somebody has to take the ball and run with it and be the one to kind of bring this information to the forefront.
Matthew, so talk to about some of the external pressures, like you mentioned before, that can perhaps lead to incivility, whether it's the electronic medical records, the time pressure, all the administrative burdens that can negatively impact physicians and perhaps affect their behavior.
Yeah, gosh, you named a few of them. You named quite a few of them. I would say that our professional politics is a factor as well, right? I mean, we're kind of primed to walk into the operating room, and sometimes a tense environment. Our politics, professional politics, can be very tense. My daily inbox is inundated with that kind of stuff, and so we prime our brains to walk in, and the people that we need to collaborate with are often sometimes portrayed as being the people that we are fighting against, and so I think that's a big one. I think advocacy is 100% necessary. I have to advocate for my specialty, and so do the other people and the other specialties around me. Advocacy is our responsibility to our professions. But at the same time, we have to be able to take a breath when we walk into that collaborative environment and say, okay, these people aren't against me, right? These people are good people who came to work today wanting to do a good job, wanting to be fulfilled in their work, wanting to go home satisfied with their work, and wanting to come excited to do it again tomorrow. And so I think that pause before walking into those clinical spaces is incredibly important.
And Chris, let me ask you the same question. You practice across the Atlantic Ocean. Tell me about some of the external pressures that physicians there face that can negatively impact their behavior.
Well, the same things that you mentioned previously. It's the time pressure. It's the volume of patients that are coming through the door. It's that everybody's being pulled in lots of different directions. And it can be overwhelming. What happens when we get overwhelmed is that bits of the niceness perhaps drift off at the sides. We forget little bits of the interaction and we do something else. We start to judge other people. We look at someone else's behavior and we think, oh, you did that because you're a bad person, or you did that to make my day harder. And the truth is, people generally don't do that. There are a very small number of people who do, but most people don't. Most people are doing what they think is right within the system. And if we can step away from judgment a little bit there and step towards curiosity, step towards trying to understand people rather than fighting with them, then we start to open the door to sets of behaviors where we understand what's going on in our environment better. And that means stepping away from the desire to be right all the time. And there ain't no doctor on this planet who doesn't want to be right all the time, because we do. Stepping away from wanting to be right and stepping towards trying to do the right thing, which is collaborative and requires a lot of understanding of each other. And for me, that's been the big thing that's helped me to move into a slightly different space when I'm in disagreement, when I could potentially be in conflict with somebody, is going, hang on a second, they know something I don't know. And maybe I can listen to understand rather than listening and then fighting to win.
Chris, do you have a story that can illustrate that? Is there an example either from yourself or one of your colleagues where they have implemented some of these techniques and demonstrably moved the needle when it came to their incivility?
Yeah, well, I think it's important. It's the perception of incivility as well. This is going to sound like a weird little story, but one day one of my colleagues came up to me and said, what happened? What did you do? And I'm going to call this person Margaret. What did you do with Margaret? She's really upset. And I didn't think I'd done anything with Margaret. And he said, well, she said that you, and this is really difficult for me to hear. She said you touched her inappropriately. Now, in my head, I couldn't think what it was. And then I thought, and then I realized in a meeting previously, she'd been really angry about something, not at me. And she was legitimately angry, but there's nothing she could do about it. And I had given her what I give my nieces, which is a sideways hug. When they're in their teens, don't hug my nieces straight on. I give them a sideways hug, a wee squeeze across the shoulders. And it's just my shoulder to their shoulder, one of their shoulders. That's it. And I said, it's okay to this person. This is just going to settle down. And she found this horrible, that I had touched her, that I'd done this. Now I work in emergency medicine. We're rubbing up against each other all the time. I'm not the sort of person that likes a lot of physical contact. but I'm so used to it that I thought that was normal. When this person told me, I realized that I'd caused her tremendous offense. And I went and spoke to her, and I went and apologized, because it wasn't my intention. And I went and spoke to her. And this act that she had found very negative, she forgave me for. And then much, much later, I found that she was going through a really terrible time at home. And there was a lot of really difficult things going on in her home life. And I had effectively triggered her, but we trigger people without knowing about it. And if nobody comes and tells us, we can't do anything to fix it. And I've said this before, but most people are good. If we give them the chance to make amends, they will go and make amends. If we don't get the chance to make amends, what happens is that becomes our reputation. We are somebody who does these bad things. And I like to think of reputation as your theme tune, the music that plays in other people's heads when you walk in the room. And your theme tune gets darker and darker till your theme tune is the theme tune to Jaws, when you walk in the room and everybody just goes, oh, good grief, it's him. But you can't fix that if nobody tells you, because so much of this stuff just isn't obvious, and it isn't obvious that we've caused people offense. So that's one example of a number of times when people have told me about stuff that's gone wrong.
We're talking to Matthew Sherrer and Chris Turner. Matthew is an anesthesiologist. Chris is an emergency physician. Their KevinMD article is "The Shocking Impact of Incivility in Healthcare. Are Your Team's Behaviors Putting Patients at Risk?" Now, I'm going to ask each of you just to share some take-home messages to the KevinMD audience. Matthew, why don't we start with you?
Yeah, Chris said a minute ago, the idea of curiosity, right? Just assuming positive intent. When somebody says something, don't assume they're a horrible person right off the bat. People come to work wanting to do a good job. So listen, try to understand, and then maintain that curious attitude, because they do know something that you don't. Everybody out there knows something that we don't, right? So try to create an environment where you can bring that thing to the surface, because in our world, information is the currency of safety.
And Chris, we'll end with you. Your take-home messages to the KevinMD audience.
So my take-home message is this, Kevin. Behavior matters. It matters in a demonstrable, measurable, material way. And how we treat each other can be the difference between poor performance and excellence.
Matthew and Chris, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thanks, man.
Thank
Thanks for having me.
Kevin. Lovely to meet you.